Okay, hi. So I've had back pain for a number of years. I had a surgery maybe 20 years ago, L4, L5 discectomy. I've also been an active and very active tennis player for maybe 30 years, and something went kind of south not too long ago. I decided to go to Mayo Clinic because I heard of them, being, super great with, all the medical research and the different doctors and so forth. So I went to see them, and initially I saw physical therapy people that said that, there was nothing else to be done. Then they scheduled me with a surgeon, and this surgeon, I met with him one time. I didn't have any MRIs, but then I came back and had the MRI, and he basically wanted to do this massive drastic surgery where coming from the front, get a vascular surgeon involved to move some arteries, move all my intestines, do a 5-hour surgery, and then flip me over and do some work at the back. And it just seemed a little drastic to me. I wasn't really enthused about the way he explained everything. He was too quick, kind of cavalier, and nothing like Dr. Abbasi here, who was very thorough and took his time, showed me what he might do if in fact even surgery was an option. So I like the whole idea of him doing his research before just opting into surgical procedure right away.
Of course, yeah. Yeah, Dr. Abbasi, I hear that all the time from patients, that he really took the time to explain.
He did. He took the time to explain. He said, number one, you first have to try some physical therapy, even though I've done some before, but he said to do that. Then he really wants to study and really understand exactly what happened in my first surgery. So I just felt comfortable with Dr. Abbasi. He's got a great personality. He has obviously lots of experience. Before I even came here, I researched, somehow I was at Mayo actually, waiting in line, and I started Googling different things, and I found Inspired Spine. And then when I went back home, I checked, and I saw some videos of what Inspired Spine does, and I like the fact that it's minimally invasive, less blood loss, less risk, less potential for infection, and that's what I'm looking for. Not this major
Right.
major surgery.
Did you go through with the previous surgery at Mayo?
No, the one I had 20 years ago was in Illinois when I used to live there, Lutheran General. It was an L4, L5 discectomy. It was pretty basic surgery to alleviate some pressure.
Sure.
This now, whatever is going to happen now, is going to be a little bit more intense. So.
Of course. Okay. So how has your pain kind of impacted your life? Have you had to stop playing tennis and things?
Yeah, oh yeah, I stopped playing tennis, which is terrible because I was a tennis addict. I loved it. I played 4 days a week, and that number one was tennis. I couldn't play anymore. I missed my cardio. It used to give me, lots of cardio. So now I can't do anything that's very strenuous. Can't do things with the family that I really want to do. Can't go for long walks. Can't lift any objects. So I'm really looking forward to getting some kind of relief here at Inspired Spine.
Okay, thank you.